Good morning all. I will be presenting on clinical and biochemical characteristic of patients with vascular occlusions in post-COVID-19 ROCM. So as we all know, ROCM in COVID-19 patient was a devastating complications associated with vascular occlusion. So the aim of the study was to evaluate the clinical and biochemical characteristic of patients with vascular occlusion in post-COVID-19 ROCM. So it was a retrospective study taken at a COVID-19 dedicated tertiary care center, and 22 patients with vascular occlusion post-COVID-19 stage 3C and 4 were included in the study. It included clinical parameters and the biochemical parameters, which included the inflammatory parameters like neutrophil to lymphocyte ratio, lymphocyte to CRP ratio, and serum ferritin. So 22 patients either developed or presented with vascular occlusion during the course of hospital stay during the ROCM treatment. 17 patients had pre-existing vascular occlusion, while one developed ophthalmic artery occlusion secondary to surgery. One patient with stage 4D had bilateral central retinal artery occlusion. So 18% of all the hospital admissions regarding post-COVID-19 ROCM patients had vascular occlusion, out of whom 82% had stage 3C ROCM. So it had a male predominance, and the mean duration of presentation after COVID-19 was 3 weeks. So 21 patients had presented with a negative perception of light at presentation, and one patient with BRAO had a vision of a counting finger of 4 meters. Almost all the patients had ophthalmoplegia. 4 patients had presented with CRAO, 1 with combined vascular occlusion, 1 with BRAO, and 16 with ophthalmic artery occlusion. All the parameters were deranged in these patients. When we compared stage 3 patients with occlusion with stage 3 patients without occlusion, that is stage 3A and 3B, there was no significant difference between the biochemical parameters. This is a fundus photo showing right eye combined occlusion with neovascularization of the disc, and the same patient had florid neovascularization on OCT-A and a thinning of the retinal layers on OCT. The same patient had a normal internal carotid artery with normal branches. This is a patient showing superior branch retinal artery occlusion in the right eye with a normal left eye. This patient shows a left eye central retinal artery occlusion with a cherry spot with a pale disc. This shows a left eye ophthalmic artery occlusion. So 18 patients underwent sino-nasal orbital debridement, with 3 patients undergoing exenteration. 2 of the patients with stage 4D died, and at 4 weeks, only one patient improved in visual acuity who had BRAO. So isolated ophthalmic artery occlusion with orbital infarction syndrome have been reported in post-COVID-19 patients. CRO is a comparatively rare manifestation with 16 to 20% prevalence, and it results due to contiguous spread of angioinvasive fungal infection because of necrotizing vasculitis and thrombosis of the central retinal artery, or due to the thrombosis of the internal carotid artery. So these are some of the papers which highlight the occlusions with invasive ROCM in post-COVID-19 patients. So in our subset of patients, approximately 73% of the patient developed ophthalmic artery occlusion, whereas 18% had CRAO and 8% each had combined vascular occlusion and BRAO. So the blood sugar and the inflammatory markers were similar in post-COVID-19 stage 3C ROCM patients with and without vascular occlusion. So basically it can be attributed to the angioinvasion rather than just being contributed solely by the inflammatory biomarkers. So to conclude, this is the largest set of patients reported to develop vascular occlusion post-COVID-19 ROCM, and angioinvasive fungal infection from the orbit is responsible for vascular occlusion rather than the high inflammatory markers. The limitation was the retrospective nature and lack of more of inflammatory parameters in these cases, and lack of MRA in every case. It had a relatively shorter follow-up, and strength being the largest case series of retinal vascular occlusions. So to take home, this can be relevant in making both ophthalmologists and physicians treating post-COVID-19 ROCM patient more aware of this uncommon possible devastating complication. Thank you.